Lyme disease is on the rise in the UK. Caught early, it can often be treated successfully, but left untreated or undiagnosed may result in ongoing health problems. One of the most crucial tools in the battle against Lyme disease is awareness. In this video, we'll share the latest information, including referenced guidance from the RCGP Lyme Disease Toolkit and the NICE Lyme Disease Guideline. Together, we can better understand and prevent this disease. Ticks that carry Lyme disease are found all over the UK and are active year-round. They can be found in wooded and grassy areas, but also in urban parks and gardens. Ticks can be as small as poppy seeds, so it's important to check yourself, your children, and your pets after possible exposure, and remove any ticks you find safely. Tick bites are usually painless, and only 1 in 3 people are thought to notice they've been bitten. One possible early symptom of Lyme disease is an erythema migrans, or EM, rash. But while an EM rash can appear up to 3 months after being bitten, at least 30% of UK patients may have no rash and may not even recall a tick bite. EM rashes may persist for months, but are not usually itchy or painful. The rash can be atypical in appearance. This can result in cases being missed or patients being misdiagnosed with ringworm or cellulitis. It can also present differently on darker skin tones. On its own, an EM rash is diagnostic of Lyme disease, and treatment should begin immediately, without the need for a blood test. Other symptoms of early disease may include a flu-like illness, stiff neck, malaise, migratory muscle and joint pain, headaches, cognitive issues, and paresthesia. Symptoms can vary from patient to patient, so it's important to be aware of the spectrum of symptoms and their migratory nature. There are some crossovers with, and subtle differences from, COVID-19 symptoms. Laboratory tests can be used to diagnose Lyme disease, but no test is 100% reliable. Both false positive and false negative results can occur. There is no test of cure for Lyme disease and no test to monitor disease progression. If an ELISA antibody test is carried out within 4 weeks of symptom onset, the test should be repeated at the 4 to 6 week mark, as antibodies take time to form. Immunoblot tests should be carried out for patients who have symptoms that persist for more than 12 weeks, although this test is not fully reliable either. Ultimately, a high index of suspicion will reduce the risk of a missed diagnosis. Do not rule out a Lyme disease diagnosis if tests are negative. Whatever the route to diagnosis, consider starting treatment with antibiotics while waiting for test results. NICE treatment protocols recommend higher antibiotic dosages than are used for most other infections. Patients, particularly children, are often undertreated for Lyme disease. Antibiotic treatment recommendations for Lyme disease vary depending on age, weight, symptom types, and whether or not a patient is pregnant. A second consecutive course of antibiotics should be considered if symptoms persist beyond the first course. Ticks can be infected with multiple infections, and Lyme disease co-infections may complicate the clinical picture. If the diagnosis is missed, or treatment is inadequate or delayed, patients may develop chronic persistent health problems. There is ongoing research into the cause and management of persistent symptoms. Possible explanations include ongoing infection, immune dysfunction, and tissue damage. To find out more about how we can beat Lyme disease together, check out the links for the RCGP Lyme Disease Toolkit and NICE Guideline for Lyme at lymediseaseuk.com/clinicians.